Hi guys, as we begin 2023, a number of problems still plague the NHS. It's facing a staffing crisis due to both the pandemic and to Brexit. And while the focus does tend to be on nurses, junior doctors who play a vital role in the health service are facing breaking point. The Tory government seems disinterested in their concerns, and this has resulted in many leaving the profession or finding jobs elsewhere. Here, Emma Runswick, a junior doctor, spoke to Times Radio about the problem of retention of staff. Have a listen.
So 4/5 of the doctors who responded telling us that they were planning to leave talked about pay and working conditions as the primary motivators for moving, often to other countries, where, like Australia, for example, where pay is significantly better and they can provide the care that they really want to provide to patients outside of the NHS, which is mid-collapse.
And pay is a lot better to what degree?
Well, I've spoken to a colleague yesterday who went to Australia, and the rates there are 3 or 4 times what you can achieve in the UK. So it's quite a significant difference. In other countries, the gap is smaller, but the pushes out of the NHS at the moment are so significant. If you've just been through a pandemic and the worst working conditions that you've ever experienced, unfit PPE, and then you get applause through that period from the government, and then they hit you with a 10% real terms pay cut, you've really got to ask yourself some questions about whether the government value the care that you give to patients. And if you're working in crumbling hospitals, if your IT doesn't work, and then you get pay cut after pay cut after pay cut, you have to really think about, is this a government that values my skills, or can I do better elsewhere?
Can I do better elsewhere? And as the example demonstrates that that Emma gave, somebody working in Australia getting much better pay. And we've seen over the last number of years, at least the last 12 years, how the Tories just don't give a crap about the NHS and don't give a crap about the staff who work within it. And if you don't provide them with the support they need, if you don't provide them with the resources they need, and if you don't pay them well enough, of course, what are they going to do? They're going to leave. And as we know, those who leave create a problem for those who remain. Much heavier workload, more stress, and higher cases of burnout. And unfortunately, there's also a problem with not just the Conservative Party, but with the public. And this was posted by a GP on Twitter on the 30th of December. It says here, anti-GP violence, abuse and aggression continues unabated. This is our waiting room. Yesterday, after a patient trashed it. Negative media narrative, anti-GP rhetoric, unrelenting demand and unrealistic expectations lead to this level of violence. Where will it end? And you can see here images. I'll just make it a little bit bigger so you can see chairs overturned, leaflets thrown all over the place, a table damaged. This is completely unacceptable. This is... Why would somebody want to remain a GP? Why would somebody want to remain a junior doctor if they have to experience this type of crap? You have, on the one side, you have the Conservatives and their friends in the media running down nurses, claiming that they're earning huge amounts of money and they don't need to go to food banks. And then on the other side, you have patients abusing a service that is there for them, that is free at the point of use. It's completely ridiculous and unacceptable. And unfortunately, it's not going to get any better because the government don't care. They're interested in painting doctors, nurses as the bad guys here. And their friends in the media are willing to push that narrative too. And then you have idiots in the public who get their information from social media or get their information from the likes of the Daily Mail or the Express. And this is what they do. Not off to a very good start. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.